Hi, I'm Nick Merrill, Director of the Daylight Lab at the UC Berkeley Center for Long-Term Cybersecurity. I'm excited to present to you our first technical project in our Machine Learning Failures module, developed with lab members Sam Greenberg and Inderpal Kaur. Today we'll discuss the Racial Bias in Healthcare Lab we created based on a research paper authored by Berkeley professor Ziad Obermeyer. To effectively manage patients, healthcare systems often need to estimate patients' health risks. Using quantitative measures, or risk scores, healthcare providers can prioritize patients and allocate resources to patients who need them the most. In this lab, we examine an algorithm widely used in industry to establish quantitative risk scores for patients. This algorithm uses medical cost, the amount a patient spends on medical care, as a proxy for risk. Through analysis of this data, we'll discover how this algorithm embeds a bias against Black patients, underestimating their medical risk relative to white patients. At a high level, students will apply statistical and visualization methods to uncover sources of racial bias in real-world algorithms. We will discuss and evaluate how algorithms are situated in a real-world context, how they're deemed accurate, relevant, or fair, and by whom. And students will discuss and evaluate how algorithms trained on past data respond or fail to respond to a dynamic world. You can download this lab at daylight.berkeley.edu/mlfailures and work through these exercises yourself. In the lab, there's a link to a Google form for any feedback you may have on how we can improve this material. Thank you for watching, and we hope that you enjoy the lab.